Okay. Thank you very much, Ryan, and apologies to anyone who witnessed my incompetence trying to get the presentation to work there. I wish I could see you all because it's always such an interesting audience at these events, and I'm longing to hear what you've got to say. Would you all very kindly type your name and where you're from in the chat box, because apparently Microsoft Teams didn't, or the event registration didn't gather all the details, so it would be useful for us to know. And could I also ask, in the interest of good audio, if people could keep on mute unless they want to speak or until they want to speak, and that will enable us all to hear more clearly. So I'm going to speak fairly briefly about data tools developed to inform local responses to COVID-19 today. I should start by introducing myself probably. Quite a few of you know me already. I've been in the SEN and disability research world for quite a few years now. I work very closely with CDC on data questions, trying to drive improvements in data on disabled children. And I know this audience knows the importance of that as an essential thing for knowing what you're doing, why you're doing it, and if it's working. So today's workshop really focuses on the current context that we're all living in. I will talk only for about the first 15 minutes. I'm going to just do a whistle-stop tour through the changed regulatory context around data sharing and the sort of imperative to identify and support vulnerable children and young people. We'll take a very quick look at some of the sort of off-the-shelf online tools that exist to help with this. I've got one local example, which we just found last week from Stockton-on-Tees. And then most of all, I'm really looking forward to hearing from you about what approaches you're using locally and what you've developed, because we think there's been a lot of really useful innovation that we're very keen to learn from and retain beyond the pandemic. There will be an opportunity to ask questions. When I stop talking, I would strongly encourage you to ask questions and speak then, and hopefully there'll be lots of time left for that. So first, onto the regulatory context. There's a lot of regulation out there, as you know. The civil servants must have been writing it morning, noon and night, and over the weekends, I think. I'm not going to go through all of it. I'm just picking out one bit of DfE guidance, one notification from the Department of Health and Social Care, and a little bit from the Information Commissioner's Office, all pretty consistent. The first, which really set us off on this journey, was from DfE on the 22nd of March, instructing educational providers, local authorities and other partners to take steps to identify their vulnerable children and young people in the pandemic, with the hope and expectation at that time that most of them would still be going to school, and considering how best to support them. That bit of guidance also noted that GDPR regulations should not get in the way of doing this, since this is really all about keeping children and young people safe. And of course, there's a very wide definition for vulnerable children, not just those known to children's social care, but also the whole SEND cohort potentially, and those on the edge of care, those at risk of being NEET, those in temporary accommodation, and many other groups who you'll know of. In terms of the sort of key health document, there was a notification from the Secretary of State for Health and Social Care, which was really sort of slightly relaxing the usual, what they call COPI regulations, the Control of Patient Information Regulations, encouraging healthcare organisations, GPs, local authorities and arm's length bodies to share information to support efforts against coronavirus. Now that holds until the 30th of September. It's really been quite a significant change, and it may be extended beyond then, but if it's not, it will expire on that date. This is all very consistent with the guidance from the Information Commissioner. There is a wealth of good advice on that website for normal times and for the extraordinary times we all live in at the moment. Their guidance really emphasises the importance of flexibility and pragmatism, and they are investing more of their resources at the moment in supporting local areas to do this well, and less in sort of any regulation really. They're taking a gentle, supportive approach. There's some specific guidance on their website for health and social care organisations as well, but it's very consistent with the extract I'm showing you here. So that is a very quick tour of what's been going on in terms of the wider regulatory context. Now, a quick look at some of the data tools. There's three ones that I was going to mention, and I'm going to focus mainly on the first of these because I think it's the most useful. I'd love to hear about other off-the-shelf tools that you may have found. So the tool I wanted to talk most about is the one developed by the Office of the Children's Commissioner. You may well be familiar with their vulnerability profiles that they've developed over several years now, which have now been tailored to reflect the current context, the particular circumstances of the pandemic and which households may be at risk. It's a live resource which they regularly update, but you will probably have some more up-to-date data locally. They are currently just updating their platform to make it even more accessible. This data is at group level, so it will tell you about local cohorts of children who may be at risk in terms of their numbers and their prevalence. And they've grouped the data into three groups. The first is really about sort of the child's context and circumstances, their household circumstances, with things like domestic abuse, risks that might be in the household, mental health problems and so on, things like digital poverty, overcrowded housing and so on. And I've got an extract to show you on the next slide. There's then a group of data around those children known to services, many of whom would normally be in support of specialist services or perhaps targeted, some of which has been interrupted, of course. And then these data are broken down for the under 5s age group and sometimes for the under 1s age group. So a couple of screenshots to show you. This is from that first group of data, the one about the household circumstances of children and young people. And as you can see, there's a lot of data around what they call the toxic trio of domestic abuse, mental health problems, and drug and alcohol dependency. They've also got maps, which I will show you on the next page, that present this data. Then there's a lot of indicators on poverty, overcrowded housing, other household pressures like a new birth, and also a lack of access to the internet, which of course has been so important for delivering education and a lot of support during the pandemic. So that's the maps that they've got, which are just at local authority level. You might be able to do these data in a much more granular way. The second tool I wanted to mention briefly, LG Inform is generally a really useful data tool, and there is all sorts of useful data they've pulled together on COVID-19. But the only thing I would stress is it covers the full age range. And doesn't have so much specifically focused on children and young people, but there are some graphs on children and young people with the usual social care SEND and things like alternative provision indicators. There's also a lot of useful signposting to other data sources on vulnerable groups like those at risk of modern slavery. Another data source I wanted to mention, particularly with respect to working with charities and community organisations in the pandemic, there's a tailored data resource that's been developed by New Philanthropy Capital aimed at that sector and also at funders, trying to encourage them to think about where they target their efforts. It's got a lot of the same range of data from health, housing, deprivation and so on, and vulnerability. It's not focused particularly on children, but rather on elderly groups, ethnic groups and lone parents as groups who they all deemed were particularly at risk in the pandemic. Of course, children may be living in those households. And there's some really interesting data added from 2 UK charities who've been very active during the pandemic in supporting local families. And they've provided a breakdown of data on the applications they'd received, showing families' needs, what their support needs were and their demographics. And that does include some disability data, as well as quite a lot on things like mental health problems, emotional well-being and so on. So some interesting data to look at there potentially. Right, onto the bit we're probably all most interested in, what's been going on locally. I'm really excited to find out what you've been doing. We've had some good examples in the first workshop we've just held. there's been a lot of rapid research during the pandemic. On this slide, I've got a quote from a bit of very quick qualitative research done by the Early Intervention Foundation and Action for Children, which was looking at sort of how early intervention had been impacted and sort of what would be going on beyond the pandemic. And there are some really promising glimmers of light around how the pandemic might have unblocked some long-standing issues in relation to data sharing between public health, schools, children's centres and local authority early help services, and also the desire to retain some of these gains in the longer term. So with no further ado, I will get on to the one local example I have got so far, which is from Stockton and Tees. I owe big thanks to Stockton and Tees because I only stumbled across this example last week, and they have been very patient with me in supplying this information and checking it for me. So this is from them with my thanks, and there's also contact details if you want to find out more from them directly. I was very impressed with what we saw. So this is from them, very much a work in progress rather. They have managed to pull together data. Initially, quite a lot of it was a sort of paper trawl from the individual services, but now it's being done electronically on over 10,000 children and young people and counting. And they've achieved this by really close partnership working between the local authority, health and local providers. One of the most, it looks like a giant Excel spreadsheet, a very colourful giant Excel spreadsheet. The most interesting columns are the ones that you see first of all. There's a first summary column which shows involvements, which shows which services, just through short acronyms, are involved with children and young people at present. That reminded me a bit of Contact Point, for those of you that remember that. It also records who's last been seen, some personal information and identifiers like NHS numbers and the essential school details, social work details and COVID-19 status. So those are the first columns that one sees there. All the data supplied by agencies is RAG rated, except it's RAG plus one extra level. So they show their assessment of whether a child is anything from most vulnerable to least vulnerable using red, amber, green, purple. And that gives a very at a glance, enables one to make a very at a glance assessment of how vulnerability is stacking up across the cohort. Drawing together a wide range of data, as one would expect, children's social care and early help, and the SEND data, but also other sets like vulnerable, exploited, missing and trafficked, which they're finding a lot of links with the other vulnerability statuses, youth support services, NEET status, health visitors, CAMS, community health services, speech and language therapy, continuing care and so on. Really interesting range of data. And they're currently working on getting more of their hospital data in as well, and data on long-term health conditions, young carers, and care settings for the looked after cohort. So in terms of some of the nuts and bolts of it, it's now imported electronically after a lot of hard work at the start to compile it at first. And it's exported via Excel, but soon we'll be using much more user-friendly Power BI reports. Weekly lists go to each early years setting and primary and secondary schools, and the local authorities' early help teams use those as an engagement tool with those schools and settings, and use them to monitor those vulnerable children and identify what's happening to them on an ongoing basis. It's also looked at a strategic level, so there's a weekly report to the Children's Services Leadership Team, and they look at how vulnerability is stacking up and varying across the borough and how resources are being allocated. They're very excited with what they've managed to achieve already, and very focused on how they may be able to retain it beyond the 30th of September, when the regs, of course, may tighten up data sharing requirements. That information was provided by Joanne Parker. Her contact details are there, and she's very keen to link up with others who are working on similar things. So really, over to you now. I would welcome any questions about anything I've said, or if you've got questions for other local areas. But most of all, I'm longing to hear from you about what you're doing in terms of joining up your data in the context of the pandemic. So there's some questions to leave you with. If you want to speak, could you write either question or speak in the chat column and your name, and I think Ryan's going to bring people in. Thank you.
Great, thank you ever so much for that, Anne. And if anyone has any kind of questions or queries, now is the time to unmute yourself or pop a comment in the chat and we'll pick that up.
Hi, can I ask a question that's not directly linked to what you've just shown, but I think is parallel. So the issue of recording outcomes, especially educational outcomes in SEN, has always been problematic, but it's going to be even harder now with obviously the gap. Is there any work that you're aware of to facilitate a kind of a mechanism whereby that would be done in any way other than, you know, laboriously going through hundreds, maybe thousands of annual reviews?
Is that a question to me?
Well, to either of you, really.
No, I don't know of a way to do it at the moment, but I'm sure there are some good examples out there. I don't know if anyone else on the workshop could answer that. So that's particularly to find a way of sort of tracking your outcomes for children with EHCPs. Is that correct?
Yeah, and measuring the kind of the gaps that will have arisen through the lack of engagement that they've had over the past few months.
Okay, I don't know that, but we can, if anyone else could come in to answer that, and if we do find that answer, we can get back to you with it. Sorry, who's that question from? I didn't get your name.
Sorry, it's Eamon from Surrey.
Okay, thank you. Yeah, I can see you in the chat column. Is anyone able to shed light on that one?
I can't shed light on, but I think we've got similar issues. We're doing a piece of work across CCG looking at the impact, and it's really struggling on how to do that. And I think it links to that kind of outcome question within EHCPs. So yeah, just sharing that we're in the same position really, rather than providing any sort of answers. And I think it's going to be a long term. You know, we're going to. It's not something that's going to resolve itself quickly.
Okay, and sorry, was that Catherine Williams?
Yeah.
Yeah. Okay, thank you. Does anyone have any local examples to share of what they've been doing? I say we'd love to hear about examples similar to Stockton, or maybe you've taken a different approach.
I mean, I'm happy to share from an Oldham perspective if that helps what we've been doing.
Lovely, thank you.
So, I mean, essentially what we've looked at is creating a vulnerable group work stream where we've connected together, similar to what you've described there, although not quite as extensive data sources. So we've used social care input, we've used input from some of our health colleagues, although not necessarily into the same spreadsheet. But we've also used education links. So what that's allowed us to do is provide a daily action log and phone calls to schools, essentially looking at two things. One's the safeguarding aspect, one's the attendance in terms of children who are there to make sure we've got them captured. That's been really helpful from our perspective to assure that, one, we know where children are and what they're doing, and being able to connect that with a social care perspective. Where we've moved and are moving on to is to try and integrate some wider data sources into that. So from a SEN perspective, my world, we've really connected the risk assessment work that we've done with schools and their returns to the regional endeavours confirmation calls. So we are in the process of calling all parents or young people to confirm their regional endeavours work that's been going on, and whether they feel most or some of their healthcare plan outcomes are being met through the altered provision that's available at the minute. That's already providing some really interesting outputs, really, in terms of analysis. And the plan that we're looking at moving forward is to use that to inform the stepping up of services. So it was really interesting seeing the slides that were shared by colleagues in the first session. Therapy is coming through as an issue for us, physio, etc. So we're looking at how we can link the aspirations of our community service teams with what parents are saying we are desperately in need of these particular services being stepped back up. So if we can connect those together, we feel that actually we're hoping to use that authentic voice from parents, young people, etc., to really input into how quickly we can return service provision to, we wouldn't say normal, but to some level of delivery once people return from swabbing, etc., around the 1st of July. Where we'd like to see it move to is probably more of the model that you've shared with Stockton, where they've got that far wider range of data sources being connected, and then the outputs being delivered via Power BI or Excel. Yeah, I'm really interested in how we can move to that stage. There's various levels of interest and engagement in doing that, but particularly like you described there with Stockton, we've got the aspiration that into the autumn term, we're keen to, where right and proper, to return this work back to a safeguarding perspective to schools as they step up their work and return to more normal operation. Because from a council perspective, we've not got the resources to maintain this on an ongoing basis, nor should we need to. Actually, it's right that sits with schools as a frontline services. But actually, we really quite like the idea that it almost gives us some assurance and quality and connectedness between our services. So SEND services, social care, and children with disabilities teams. So we get that integrated view of some of our children. And we've also toyed with the idea of actually, if we collected that either half-termly or termly at the very, very least, then actually we could then provide that back to the schools to say, well, this is what our internal view looks like. Actually, how does that compare back to you in terms of the conversations that your safeguarding team or your SEND team can be having with families to inform, like Stockton have done there, either that early help from a council services perspective, but also inform some early intervention from a school level perspective. So really interesting to see how that's connected together.
Brilliant. So you might look to collect that information in future on a termly or half-termly basis, if I understood that correctly?
Yeah, that's correct. That's what we're in the process of discussing all that at the minute, in terms of we really see the benefit and the positive impact that the work we've done so far has had in ensuring that wraparound almost assurance really of these really vulnerable children, and it's helped us to inform conversations with schools about priority returns. So I know I sat down with my with colleagues from the disabilities team to really work through lists of children that are real priorities based on the social care input, to compare that world. And it's fascinating that, unsurprisingly, they may be presenting social care in one dimension and presenting to schools in a completely different way. So, actually tying those together has really helped us to almost assess the need of these children to return to school on a 1, 2, 3, 4, 5 day basis, really. And whilst it's so difficult for schools to reopen widely at this stage.
Yeah. And have you found that's had an effect as well on your relationship with schools? Because I heard from another area that actually it's led to much closer partnership working with schools that they hope they may be able to sustain.
Yeah, I would agree with that. It's I know a number of colleagues over the past hour or so have said things that perhaps would have taken a long time have been accelerated and have worked a lot quicker. We certainly found that across various different sectors, to be honest, whether that's special schools or mainstream sectors. I mean, we've been discussing last week with the CEO of a large special school, Matt, actually how we could perhaps redesign the work. So rather than the community health team delivering what they usually would deliver at the special schools, if the cohorts are vastly reduced in terms of numbers, could we change the delivery model to be a home-based model using some of the staff from the school? So, just to have those kind of conversations, if you'd gone back a few months, well, that would have been impossible. We'd never thought of that. But actually, they're starting to suggest that, and we're linking together to look at how we can make that move forward. So that potential for almost quite wholesale redesign is really good. The challenge is going to be delivering that. And delivering that in a way that fits, as you say, with changes in guidance that will inevitably come in the autumn term. But yeah, the fact that the aspiration and the conversations are there and ready is really, really encouraging.
Yeah, definitely something good to build on there.
Totally.
Yeah, thank you for that. Did anyone have any questions for David there, or any other examples to share or reflections? Another question that was raised in the last workshop was the connection with the dynamic risk registers, the transforming care dynamic risk registers, and if people have managed to mesh those two or been making the connections between those and their vulnerable children lists or databases. Does anyone have anything to say on that, I wondered? Okay, and anything else? Anyone want to ask a question, say anything? Or else we should probably let you all go off and make a cup of tea.
Nope. Looks like you've kind of covered everything there, Anne. Would you want to share your email address in case anyone did want to kind of follow up afterwards? Or
yes, yeah, my email address is on the first and last slide.
Excellent.
And equally, our colleague in Stockton-on-Tees kindly shared her email address and encouraged people to get in touch. And yeah, let's all see if we can learn from what's going on, whether through these seminars or just through email conversations. And I know colleagues in the Children's Commissioner Office are trying to collate examples too. I'm sure there's going to be a lot of useful practice to build on.
Yeah, definitely. Well, before everyone kind of leaves, I'd just like to thank you all for joining us today, fans. Really fascinating presentation around data tools during this time. If we could just quickly ask you to take 2 minutes just to fill out this post-event evaluation form that I'm going to pop in the chat. And then what we'll do is we'll let you go, and the recording of this session will be available with the post event kind of email out. But thank you ever so much to Anne and to everyone else who shared during this session.
Yeah, thank you all very much. Okay.